Welcome everybody. Whoa. Test.
Aliens are attacking.
Test. Safe. Stand. Sitting at the big table.
We used to sit at the table. Now we're sitting in seats.
Hello.
It's very 1970s song. My mic is turned up. Speak so. Right. Now he's fixed.
Through these microphones, you think, or?
Don't know yet.
She decided that she was done trying to make friendships and became an introvert in her room throughout most of high school, focusing her attention on online relationships and her studies. At age 15, I found drugs in her room. I called the police and everybody shrugged their shoulders. She received some counseling in high school weekly, which I thought helped her navigate her weekly tragedies with kids, but it didn't really help her develop the patterns of thinking she needed. By focusing on herself and her grades, she was able to be accepted into a program her senior year and had the best year of her life. But by the middle, she was forced into a small group of 12 students. At first she was intimidated, but by the middle of the year, she felt comfortable and she had the best year ever. With lots of optimism, I felt like we had won this battle. She graduated, had found a nice boyfriend, and was looking forward to her transfer acceptance at Cornell. She's a very smart girl. Then her friend committed suicide. I had no idea how close their friendship was, mostly because she had all friendships online. Turns out they were suicide buddies, as he had written in her yearbook. She spiraled quickly and started using serious drugs once her boyfriend also left her. This led to her second visit to the hospital in the ER and her first diagnosis of having borderline personality disorder. But still, no one told me that she needed special help. In fact, I was advised that she start taking benzos to help alleviate the constant anxiety that she felt. Her pediatrician thankfully said no way. So now that she was 18, I was now helpless to manage her appointments, decisions for medical care, and anything that she did. Somehow, miraculously, she made it through 2 years of college, during which she had 2 more ER visits in between to sober her up. She made no meaningful relationships from living in a dorm, then ended up having sexual assault added to her list of problems at a frat party she attended. Yet still no one mentioned that there was hope for treatment or for why she was using the drugs. As she was starting her junior year, she realized she couldn't manage life anymore and went to her first rehab stay. I looked nationwide for a program that specialized in DBT therapy. Not one took insurance. Finally, we came to a financial arrangement with a program in Utah, which ended up just to be a scam. I had to quickly move her out into another facility nearby where she did complete 3 months being sober, but didn't do anything to solve the underlying way her brain worked. And there were no sober living programs near here for her to come back to. We found another scam that she entered in Philadelphia, where she then was only at for 3 weeks. She attended some online DBT outpatient programs and started quickly using again while home. Within 6 months, she went back to another rehab program, which then after 3 weeks discharged her because she was too overwhelming for the program to handle her inability to control her emotions. That program left her devastated and reinforced her feelings of being unworthy for treatment. Luckily, she found an EMDR therapist here in Ithaca that worked with her for 4 months, but then also dropped her, stating she didn't have the time for the commitment that she needed. Let me also mention that throughout these past few years, while managing herself now as an adult, she found therapists and providers that would prescribe drugs that she wanted. She was now on Adderall, gabapentin, Abilify, a whole slew of things of antidepressant cocktails. She would abuse them and run out of meds, and midway through the month create a constant cycle of instability, and then supplement with an array of herbs, vitamins, nutritional things, find online, enhance or change her moods. She was abusing nicotine flavored vapes because they were so readily available. There was no cohesive connection between the therapist and the prescribers, and now she was officially lost in the mental health madness. All she wanted was to fix the feeling of wanting to actually die. As much as I hated seeing her use and abuse drugs, I knew that they were actually keeping her alive. It was the estimated 10% of people with BPD actually commit suicide, and many more die of overdoses. My question for this group is not why one of these programs that she attended, why through all of the years of struggling since she was a toddler, actually was able to help people with borderline personality disorder. She looked at CARS, PROS, or pediatrician, Cornell Health, 4 or 5 different therapists, psychologists, psychiatrists. Why did not one person recommend that she gets the actual therapy that was known to help people with borderline live fulfilling lives? Why did she not be told to get DBT early on in life? Research has shown that people with borderline personality disorder use a different part of their brain for making decisions and emotional response. They're in constant a sense of fight or flight. They don't have the same connections in their frontal lobe used for reasoning that most people have. It's their lack of connections that create the lack of self-awareness and identity. They fear abandonment from people because they rely on them for their identity. Those connections can be restored and repaired through an amazing program developed by Dr. Robert Gregory in 2017 at Upstate Medical Center in Syracuse. It's called the High Risk Program and uses a new model called DDP therapy. My daughter is now living with a man she met 3 weeks ago. He supplies her with an array of substances. She feels like she's known him her whole life and has chosen to leave home where she claims she was abused. I am learning through my support groups for parents of children with BPD the constant theme of pushing parents away around this age, which is when they become increasingly hostile and blame the parents, especially the ones they're connected to, for everything. The anger is intense and extremely difficult to live with. I'm going to play some of that for you, but I'll spare you. So what happens next now that she's gone? Will I find her in the jungle or the inlet dead? I am praying she gets accepted to a program called Lakeview Assisted Housing, but was she willing to go? The program is Syracuse won't take her, look at her anymore because now she's on too many drugs. She has no support system. Why, when we have been in the system so long, has nobody helped her? That's my question.
Thank you for sharing that heartfelt and very difficult story.
If you have any questions about this revolutionary therapy that I had to discover on my own, that one doctor suggested that she tries to get into it. There's some information on it. It actually has a 90% cure rate for people who borderline.
So we don't usually get into a dialogue here. However, you've given me permission to give your name out to anyone that wanted to contact you afterwards. And is there anybody that wants to follow up, please come through me. And is there anybody that would like to say anything at this point? Mike.
Thank you. I literally have known you for years. I had no idea of any.
It's a hard battle.
Well, and you're not alone. I mean, there's a lot of people.
And I'm here to speak for, I watched a meeting in February where a mom was spilling on her guts about the same thing and she had lost her son. I mean, these kids, BPD is one of the largest reasons why people use drugs. Consistent drugs. And it's something nobody wants to talk about.
Thank you.
Thank you.
Okay, we are going to continue with the meeting. The next up is chair's report, and I don't really have anything except to tell you that J.R. Claiborne contacted me and asked to be excused from this meeting, so he won't be here. Legislator Mike Sigler needs to leave a little early, so we might do a little shifting of the agenda. And that's all I've got. Okay. Well, actually, I do have one more thing to mention. This committee earlier in the year passed a resolution that we sent to Albany asking them to raise the minimum wage for home health aides, or sometimes they're called different terms. And I am not saying that it was our little resolution that did it, but there is something in the budget that I haven't heard any details yet, but it's going to be a $3 per hour raise for home health aides in New York State. So, you know, that's probably not enough, but it's not nothing, and thought it'd be worth mentioning. Okay. Next up is County Administrator's report. And, you know, this is my first time sitting up here during Zoom, and now I see what they're saying. It is actually really hard to see that screen. So Lisa, you there?
Hi, Dan. Yes, I'm here. I just have a few brief updates, one of which you just referred to. I'm in preparation for the budget retreat, looking at all of the impacts to the county on the recently passed New York State budget, and looking particularly at our Health and Human Services departments and agencies. And just wanted to touch briefly that the budget looks very favorable. At least it's in these areas. It's certainly not harmful, and if anything, on the whole, favorable. We have some additional funding to support local health departments and Veteran Services agencies. So some new funding streams there. As you'd mentioned, funding for salaries to support home healthcare workers and the direct care workforce. Some of those titles we have in the county in our workforce. So we will be in the months to come analyzing how this will play out in our departments. And in areas where they've mandated increases, for example, in the foster care subsidies in the DSS budget, without increasing the state funding to pay for them. Our first look here is that this won't affect us too terribly much in Tompkins County because we're already paying those maximum amounts. So as I said, there's more analysis to come in the days ahead, and working with our departments and agencies to hear further how these details will play out. But on the whole, it looks positive for us. And that's all I have to update.
Thank you. Any questions for our county administrator? Okay, thank you, Lisa.
Thanks.
Next up. Okay, so next up is our featured presentation this month. Got a couple of people here that are going to talk about tobacco sales in the county, tobacco sales enforcement of products and enforcement to youth. And we've scheduled 20 minutes for the whole thing, for the presentation and the question and answer. You know, we don't have to stick to that strictly, but that's just to give you a guideline of how much time we're talking about. So I know we've got Skip Parr from the health department, and we were going to have Nikki from Reality Check. Is Nikki here?
I'm here.
Hi, Nikki. Nikki, what's your last name? I didn't have it down.
Cook Baker.
Okay, thank you. And anybody else here to talk on this subject?
I think it's just going to be me and Nikki today.
Okay, Skip, then you are on.
All right. So I put together a brief slide presentation. I think I shared that with you all, but if you'd like, I could share my screen.
Yes, please.
Okay. Okay, are you seeing this here?
Yes, thank you.
Okay, so I'm just going to give you a quick overview of what we do here in terms of tobacco enforcement, and in particular, flavored vape sales. And then I'm going to turn it over to Nikki. So we have a grant program that covers several objectives. So I just highlighted some of the more, the primary objectives, which we conduct unannounced compliance checks of all retail tobacco vendors and retail vapor product dealers. And so we go in with underaged folks who are under 21 and attempt to purchase. And we also, this is more recently, this occurred in 2020 where the law changed, and the state is now prohibiting flavored vapor products that contain nicotine. So we're also looking for that when we go into retailers. While we're there, we do education to the retail dealers and vendors. In addition to that, we respond to public inquiries, also complaints, and when we find violations, we do initiate enforcement actions. So we have a host of new changes that took place right around 2020, which coincided with the pandemic. And just as a kind of a side note, the program did go on pause for most of 2020 and 2021. So just recently, we restarted our activities, doing inspections and enforcement. And over the past 3 months, we've really ramped that up. But that included the state followed suit with the county shortly after the county raised the age to 21. The prohibition on flavored vapor products with nicotine, You can't have price discounts on tobacco and vapor products. Pharmacies can no longer sell tobacco or vapor products. And there's also a prohibition on exterior displays of tobacco and vapor product ads when they're within a certain distance to schools. Supposedly, you're supposed to stop the shipment and delivery of cigarettes and vapor products to residential locations in New York, and the penalties were also increased. So just a quick overview of the penalties. I kind of broke it down into two sections. We have sales to underage individuals, which is what we've been doing all along, is going in and trying to purchase with an underage person. And for a first violation, that range is between $300 and $1,500. And then for subsequent violations, it goes up to $1,000 to $2,500. And the state did increase the surcharge on these violations from $50 to $250. I think the more important thing to know is that points are assessed when there's a sale to an underage individual. So once a retail store gets 3 points, their certificate to sell tobacco and or vapor products is suspended for 6 months. And also they lose their lotto license if they have one. And those points remain in effect for 3 years. So essentially what it boils down to, if you have 2 sales to a minor within a 3-year period, you're going to lose your certificate of registration to be able to sell the product. And the more recent thing is with vapor products, flavored vapor products with nicotine, is the state has granted authority for fines up to $100 for each individual package of flavored vapor product that's offered for sale or sold. So this is just the definition of what a flavored vapor product is. And essentially, you can have no flavor other than tobacco in a vapor product that contains nicotine. So there is a little bit of a caveat to that. That's been a bit of a challenge for us in that retailers can have that product in the store because the state has provided us guidance that allows them to sell this product online as long as it's out of state. So, we created a little bit of a workaround for that in that rather than just looking for the product on the shelves, we actually have one of our staff inspectors asked to purchase the product because we have found in a couple places where it's not actually out for sale, but if you ask for it, they pull it out from underneath the shelves and they'll sell it to you. In terms of our most recent grant year, which just ended the end of March, this is what we found. So we did 52 attempts with an underage individual to purchase. Mainly we were trying to purchase the flavored vape or a vapor product. And we did have 3 sales that occurred. The other inspection that we do, we call them adult checks, where a health department staff goes in, we're checking for signage, registration, and other things that they're required to do. And what we started doing this year was when we did these adult checks, we didn't announce that we were there to do the inspection. We first attempted to purchase a banned product. And as a result, we had 9 facilities that either had on display prohibited product or sold us product. And we have enforcement actions pending on these facilities. And this is kind of just to give you an idea of what we were seeing in the field. A a lot of product. You know, I would say most places had somewhere around 500-600 individual packaged product that were flavored. So these are a couple store locations where we observed product on the shelves. And this is a situation where the product wasn't on the shelves, but when we asked to purchase the product, they had it in these, you know, locked area, and they would pull it out and then they sold it to us. So that is what we do in a nutshell. I'm not sure that I covered all your questions that you had, Dan. So if anyone has any questions on what we do here in environmental health, I'm happy to answer those before I turn it over to Nikki.
Are there any questions for Skip? Skip, I have a couple.
Sure.
Do you know, so they no ads within a certain distance of schools. Do you know what that distance is offhand?
I believe it's 1,000 feet.
Does that have any effect on New Routes and the Commons? Do you know, New Routes School, are they?
It does. And yeah, I think pretty much in terms of the Commons, I think most of those stores would be prohibited from doing advertising. We are still looking into what that definition is for advertising, because it is a little tricky how it's worded in the law. And there are a couple places that are questionable that we're looking at. Just because we recently started up here, I would say February is when we really put a push on to get out there, especially with everything that we were hearing about the flavored vapes. We really wanted to focus on that before we went out to start looking more closely at what stores had for their advertising. So I expect that's going to be more of a priority as we enter this new grant year.
Another question too. I think you said you had 52 attempts for youth sales and only 3 of them, you know, were sold only 3 times. That seems pretty good to me. I mean, I'm not sure how to think of it. But then you also had the adult sales, adult attempts. There were 9 facilities that were in violation. How many facilities we're talking about in the whole county, roughly? Do you know?
I would say there's approximately 60. You know, it changes quite often, and it's actually hard for us to keep track of because we're not notified directly by taxation and finance. So often when we run our reports, we'll see that new facilities pop up. And then often when we go out to do inspections, we'll find that some facilities have stopped selling. So generally it's around, you know, somewhere between 55 and maybe, I think we've had a high of 62 or 63 facilities.
Great, thank you. Ann.
Thank you, Skip and Nikki, for working on this, addressing this. I'm sure you were contacted by other folks, but I had sent in an email after being contacted by my constituent that was here earlier about the tobacco vaping product, flavored tobacco vaping product. So I went to one store and they had like pictures, like you said, whole walls, you know, and I asked them and they were like, oh yeah, all of these are tobacco flavored products. So that was just, maybe it was in January or something. So appreciate you guys working and the amount of work you've done since then. And so you mentioned possibly 60 places that sell these type of tobacco products, you're saying? Is this just cigarettes or also the vaping products?
Yeah, that includes cigarettes and vaping products. I don't know the breakdown off the top of my head because there's 2 different registrations now. You can get a registration for your standard tobacco products, smokeless tobacco, cigarettes. And then there's another registration specific for vapor products. Some locations have both. Some just have the tobacco and some just have the vapor product registration.
Okay, so this could include a convenience store or a gas station that sells tobacco, not
Yeah.
necessarily a specific tobacco store.
Correct.
Okay, thanks. And I guess that answers my next question. So I was going to say, are they, well, actually for the vape products, do they, I saw you mentioned about they can't be sold in pharmacies anymore. Can they only be sold in those type of standalone stores, or are they sold somewhere else now?
No, they can be, you can see them at convenience stores, gas stations. There's many different outlets. I think we've seen a rise in the standalone stores for specific to vape products. But yeah, I mean, like these pictures that you saw, they were mostly like convenient type stores, and one of them was a standalone vape store, but the other one was a convenience store.
Okay, thank you very much.
Randy?
Yeah, thank you, Skip. You mentioned you started doing this in February, I think. Do you do this different times of the year, or is it one time a year, or is this spread out among 12 months, or how does that work?
Yeah, well, it's spread out when we do our adult checks, because we have staff here that goes out to do it. Typically, when we have an underage person to work with, we'll do those at chunks at a time. So at different points of the year, we'll try to do it like around when they have breaks, but actually because now we're using a 19 or 20-year-old, it makes it a lot easier for us to do it pretty much any time of the year. We can work around like a college student schedule to get out there. So it makes it a little bit easier where we're not having to use a high school student to go out to do these checks. But I think of note, the reason why there was a push recently is because of COVID. The program was more or less on pause, with exception of formal complaints that we received. And we did receive one complaint of sale of flavored products. It was a location called Vape Dragons. In 2021, we took enforcement action against them, and that facility has since closed.
Okay, Nikki. Oh, hang on, we have another question. Go ahead.
Sorry, thank you. Sorry, you probably said this, but are all these laws that you're enforcing state level laws?
Yes.
Okay, thank you.
Okay, Nikki, you're up.
All right, I will share my screen. I also have a presentation. And to explain what I do, I work through the grant out of Cortland Department of Health, and we work also with Tompkins as part of that grant. So we cover Cortland, Tompkins, and Shenango counties, and I specifically work with the youth part of the program. And so what we do is we work with this youth 12 to 18 years old about to educate them on the ways that big tobacco markets to them and looks to them to be their next client. So we do that in a variety of ways, by exposing the practices, helping youth become empowered to change how their community is set up in a lot of different ways. And we do that by targeting some initiatives. So we work on the Smoke-Free Movie Initiative, which is where we expose that tobacco industry uses normalizing smoking in movies that are like rated PG-13, where there's really no reason a lot of time for plot or any kind of mechanism in the movie. It's just basically to make it look enticing to younger viewers. We also work on marketing in the retail environment, having, again, the signage not near schools and the advertising not near schools, working on making sure, you know, that these setups aren't like candy stores, and the youth can kind of identify where that is happening and do some initiatives around that. We work on their, just where they live, work, learn, and play. And what that means is doing things like tobacco litter flagging and community cleanups, and really pinpointing what the effects of people just smoking in parks and smoking near schools, and how much they're really just, you know, ingrained in their day-to-day environment. These are some of the things we actually have done recently. Take Down Tobacco Day we did on April 1st. We did some tabling and education out of a school in Homer. We also did some in-school presentations for the LGBTQ club in Dryden, as they are not only targeted for their age, but also as a disparity project. We have learned that they are targeted heavily in that community. We do letter writing to the movie associations to try and get movies with smoking to be rated R. So many students have signed cards or written letters. And we also participated in We've Seen Enough Tobacco Day, which is October 13th. And the symbolism behind that is that the average age of tobacco users is 13 and remains that way. And why are we here even talking? You can see the rates of smoking. This is for Tompkins County. The youth are getting it. So whether they're buying it directly at a store or an older sibling or some person who's selling it to them, they're definitely getting it. And as we've come out of COVID and as in school has been more in person, I think the numbers are gonna change a little, but that is why we are trying to focus on the youth. What are we doing? We're trying to educate policymakers, adults, parents, schools, teachers, students, and there's a variety of ways that we're going about it. There's this statewide media campaign that you will hear and see in a variety of places soon. I'd like to play a couple of these for you. Provided it works. It may not let me do it. All right. Okay. So what I can do is I have sent the link with those, but if you look up, it's not just campaign. I can send that link to someone as well. But it's basically youth voices talking about not wanting to be the next target, and the fact that tobacco is intentionally marketing. So what have we done? Recently, we are, like I said, working on the, we have a disparity in healthcare project that we're working on with the LGBTQIA+ community regarding tobacco marketing to them specifically. We're looking to branch into many communities and have some events around that for not just Pride Month, but in October when it's the LGBTQ History Month. We met with Senator Overocker and Assemblyman Lamondes and discussed some tobacco issues in their districts. We completed 2 days of vaping recruitment at Groton, and it was 8 classes, but we did a lot of lunch interaction, and that actually resulted in 8 students signing up for the program. And what's coming next? We're working with Tompkins County Public Library to hopefully have a group that meets there. That way for anybody in any of the districts can come and the youth can participate. We're looking to do some more with Dryden and their recycling club. as well as we have a mobile art installation that is a selfie mural that is mobile, so we can go to the commons and have kids take pictures and learn about tobacco marketing. We're going to continue to partner with our LGBTQ community and hopefully get some shared activities. I have included our contact information on here, but if you have any questions, I'm more than willing to attempt to answer.
Great, thank you. Do we have any questions for Nikki? Okay. Before we leave the subject completely, I wanted to ask about the sticker stores and the involvement, if any, from the county health department in monitoring, enforcement, or any of that.
Hi, Dan, it's Frank. I'll jump in on that subject. So we're kind of in a place of, I don't know how to describe it, right? So currently it's still illegal, right, to sell marijuana and recreationally. And the sticker stores, as we all are aware, are not a legal alternative to try to get around it. But there is no regulation for us as a health department under the new legalization of recreational marijuana to enforce. So it really leaves it as a criminal matter. And I think our county is certainly on record that marijuana sales is not something we want to have criminalized, but it kind of leaves us in this place where trying to address the issues that we think should be addressed as recreational marijuana becomes legal in New York State have not yet been put in place. So there's not really, authority or mechanism. And I'm not sure the local health department is even going to be the mechanism once those regulations are in place as the Office of Cannabis Management, starts to come together. So there's not a lot of good answer around the sticker shops. Other than, the Attorney General obviously has been clear about it. I think our local law enforcement agencies have done their best while trying to, work within the spirit of the county's feelings about legalization of recreational marijuana. So that's kind of where we are at this point.
Thank you. And I'll just mention this just because maybe not everyone listening knows, what a sticker store is. So a sticker store are these stores that have popped up in Tompkins County and other places where they say that they are selling stickers. And then when you buy a sticker, they give you a gift of marijuana. Just wondering, in case someone didn't know what that was. Randy.
How prevalent is a black market for cigarettes and vapes? Have you ever dealt with those issues? And I know it's out there. I was just curious what your thoughts were.
So I guess it depends on what you would define as a black market. I think Skip in his presentation talked about the under-the-counter sales that occurred. And so we found that happening in the county. So it's certainly there. I don't know, Skip, do you have anything else?
I don't. I mean, I've heard of like places or people selling, tobacco products outside, like on the street. And, that's a challenge for us because we enforce and oversee retailers. So if it's a situation where it's an unregistered retailer, we could cite it and we could work with Department of Taxation and Finance. It's a little tricky when it's an individual person selling, and we have communicated in the past with ethical police department and law enforcement in those situations. But the last time I heard of this was during the pandemic, and there was resistance, I think, to really address that from the law enforcement side of things.
Thank you.
Okay, any last questions or comments about tobacco, retail sales, enforcement, etc.? Nikki, Skip, Frank, thank you for this information. It's very interesting. Thanks for the work you're doing. It seems to me it's a little bit of a cat and mouse game, right? There's regulations and then there's the retailers are looking for ways around them, and then we try to figure out what they're doing. And so thank you for trying to stay on top of all that. All right, we're going to move on. We have 4 resolutions from public health and mental health departments. First one is appropriation for emergency disaster assistance funds for community surveillance testing for Tompkins County residents related to COVID-19. Is there somebody that would like to move that? Veronica moves, Mike seconds. Frank or anybody else, you want to tell us a little bit about this?
Sure. So this is receiving of FEMA funds to pay for the testing that has been going on. So I think the number is 3 million plus that we've collected to date. And so we need to move this onto the books for the health department's budget out of the fund that it was initially placed in upon receiving.
Excellent. Any discussion? Ready to vote? So I guess we're still doing roll call.
You don't have to do roll call.
All right, then all in favor? Sigler, thank you. Any opposed? No, that's unanimous. Thank you. Okay, next resolution, appropriation from contingent fund for terminal pay health department. Somebody want to put that on the floor? Randy moves it, Veronica seconds, thank you. Frank, got anything on this one?
This is just a basic contingent fund request for, I believe, 2 employees that left in 2021 to cover their leave balance payouts.
Very good. Any discussion? Ready to vote? All in favor? Okay, that is unanimous. Thank you. Next resolution up, budget adjustment, COVID funding, health department. Somebody want to put that on the floor? Veronica, thank you. Is there a second? Randy, thank you. Frank?
So this is federal COVID funding that we've received through the state to help pay for some of the expenses. And it's just a reorganizing on our books to account for the costs that were associated and applied to those funds.
Excellent. Any further discussion? Okay, let's have a vote. All in favor? That is unanimous. Thank you. And then we have a resolution, budget transfers across budgeting units, mental health clinic, personal recovery oriented services, and health home, mental health department. Somebody would like to, Randy putting that on the floor and Veronica seconding it. Thank you. Frank?
Yeah, so this is probably the most complicated one while being simple at the same time. In 2020, the decision was made to close our health homes program at the mental health department at the end of 2020. There were still expenses being charged to the program in 2021 as the final close down occurred. And so so there was no revenues associated with that because it was a closing down of the program. We have funding in other parts of the budget from 2021 from pros in the clinic that we're just shifting over to cover those expenses, those closeout expenses in health homes for 2021.
Okay, thank you. Any discussion about this? Veronica?
What was the health home program?
Sure. So the health home program was a case management, care management program. We have been doing case management for a very long time in mental health. And back in, I'm going to get the date wrong, I want to say maybe 2006, probably like 2003, the state made a shift to this new health homes program, which was more centered on connecting people to different services rather than the more hands-on approach, which we had been doing, like driving them to appointments. And quite frankly, the new funding mechanism for it was never sufficient to cover the costs. And so the county had been subsidizing it for many years. And during 2020, when we had budget cuts to be made, it was one of the places where it was a contracted program that the county was happy to subsidize. So it made sense for us to remove ourselves from that contract. There have been other entities that have taken up the contract, but it is essentially a case management program for high-risk individuals on Medicaid.
Okay, thank you. Helpful recent history.
Okay, did we vote on that one already? No. Okay, any further discussion? Let's vote. All in favor? That is unanimous. Thank you. Frank, while we have you, why don't you go ahead and do any updates that you would like us to know about?
Sure. Two things to mention. One, to follow up on Lisa's report about Article 688 funding being increased. That's really good news for us. They've increased our base grant. And for those that aren't familiar, for public health, we get a base grant of which will now be $750,000, up from $650,000. That covers 100% of eligible costs. And then everything beyond that, the state pays 36%. So I will tell you, you guys pay as much for our state aid. The county pays as much for our state aidable work as the state does based on that formula. So this is a help in that area. And they've also allowed us for the first time ever to charge fringe costs. So they would pay for personnel, but they would not pay for the fringe associated with those personnel. So that's a big step for us. I've been going to Albany for almost 11 years asking for those two things. And thankfully it's finally come forward. So that's good news for us and our ability to do core public health services, in a more sustainable way. The other thing I just wanted to make mention of, the branding process that we talked about, I believe at your last meeting, has continued to move forward. We had our first meeting with the consultant who is Iron Designs, which is a local company. I'm not sure if I mentioned that last time. And we had our first discovery meeting. It went really well. I think Iron Design has a good feel for who we are. They certainly know the community, having worked with other nonprofits in Tompkins County. So we're really excited that that process continues to go forward. And, we're hopeful in the next couple of months, we'll have something to bring to both the Community Service Board of Health, and then ultimately to you all for your review and approval. That's all.
Thank you. Thank you. Any questions or comments for Frank? I'm just going to mention something. I don't mean this to be quite as political as it might sound, but I'm just very impressed with Governor Hochul responding to actual concerns that counties have, things that don't make headlines, things that we've been asking for to help make things work better. And these are two examples of many that I have seen about, changing the base grant and allowing fringes. So to pull it out of the political, just, good for counties. We're getting some things that we actually need. Okay. Okay, we are up to the Office for the Aging. We have two resolutions. First resolution, budget adjustment, reappropriation of long-term ombudsman program, LTCOP, grant funds, Tompkins County Office for the Aging. And we've got a revised version. And the only addition, hopefully everyone has it in front of them, the only addition is the final resolve. And it just says further that the county administrator or designee be and hereby is authorized to execute any and all agreements necessary to complete requirements of the grant. It's nothing substantive. Is there somebody that would move that, please? Randy moves, Veronica seconds. Thank you. Lisa, you here with us? Hello, I can see you.
Hi, how's everybody doing?
Good, how are you?
Good. Yeah, so this is just a budget adjustment for a grant funding, three different grant funds that we got for the long-term care ombudsman program. And each of the three different funds, it's explained in the resolution what the expenses are allowed to be used for. So we're just following these specific rules. Basically, is to enhance our long-term care ombudsman program.
Okay, thank you. Any further discussion? All right, let's have a vote. All in favor? That is unanimous. Thank you. And then the second Office for the Aging resolution is budget adjustment, unmet needs, home health aides, Tompkins County Office for the Aging. Somebody want to move that? Veronica moves, Randy seconds. Lisa, you want to tell us a little about that one?
Yeah, so this is just moving the funds, making a budget adjustment within our unmet needs funding source to pay for the home health aide that we hired and actually just started today.
All right. Thank you. Any discussion? Veronica?
Just want to say that's really exciting news. And so glad to hear that's moving forward.
Thank you.
It is exciting. Did they get a $3 an hour raise today?
Well, we were paying above minimum wage anyway, so they've got more than a $3 raise.
Gotcha. Okay, any other discussion on this topic? All right, let's have a vote. All in favor? That is unanimous. Thank you. Lisa, while we have you, do you want to give us any other updates you'd like us to be aware of?
Yeah, the only thing I wanted to mention is that normally around in May, it's Older Americans Month, and we usually have a annual luncheon. We're still trying to stay away from gathering in groups for a long extended period. So we're having an open house, hopefully to stagger some of the people coming through our office, but we're opening the doors for anybody to come and stop by on May 13th. It's a Friday from 12 to 3. You can come in. We're going to be celebrating our older outstanding volunteer in the community. There's 2 of them. We'll be celebrating them, and you can learn more about our services and see our space. So everybody's welcome.
Thank you. You did say refreshments, right?
Oh, yes, of course. Yes. There'll be refreshments.
I'll clear that part up. Thank you, Lisa. Any questions or comments for Lisa? All right, thank you. I'm going to switch the agenda at this moment. And before we go on with any other departmental updates, I want to do the resolution we have so that Mr. Sigler can definitely be here for it.
Well, actually, Dan, I haven't done any work on my resolution here, so would you mind if I push that off till next month?
I don't mind.
Because I didn't bring anybody in, and I would like to update it anyway, so.
Okay, I do mind slightly because I brought some props in that I was going to share with everybody.
Yeah,
So I'll do that anyway, but we won't.
I do like apples. So.
You can swallow whole first, is it?
And I'm sorry, now I feel bad. You brought apples.
Okay, I'll try to bring them again next month. These are organic Fuji apples.
They're the best. These are, see, now I'm glad. Now I'll get 2 bites of the apple. I'll get two apples.
Okay.
Thank you, Dan.
All right, so we got that. That'll be next month. Yes, thank you. And actually, Mike, I just heard this, so I was thinking out loud. It's possible we have 2 presentations in May.
Okay, I could push it.
We'll still do it. We can still make it happen.
All right.
Be ready for a long meeting in May then.
All right.
Okay. Okay, then we are back to departmental updates. So let's see, how about Ken Clark, Office of Human Rights?
Okay, good afternoon.
Afternoon.
Just a couple of things to report. In recent weeks, we organized a 2-part program series on critical race theory in the effort to clarify what it is and what it is not. For instance, that it is not something that is taught in public schools or in secondary schools, and that it is not part of the trainings that take place related to diversity, equity, and inclusion, but is in fact a interdisciplinary legal theory approach that has its origins in law schools, in which is largely taught. And so we brought in 3 scholars, law school scholars, to address this. 2 in part 1. One was a professor from the Brandeis School of Law at the University of Louisville, And the other panelist was a law professor at the University of South Carolina Law School. And then for part two, which took place last Wednesday, we had a third law school professor, an associate dean, who's a graduate of Cornell Law School, to present. We did not get the greatest attendance, but we have had significant views post program. The part one program has drawn about 190 viewers, and the part two is drawn up to about 55 or so. So we are hoping to be able to provide some clarity about a much used and much abused, I would say, issue in terms of critical race theory. One of the things I do want to note too, and this is something I shared in department heads meeting last Wednesday, is that we are finding that we are seeing an increasing number of individuals who call with heightened levels of mental and emotional distress, people who are clearly very disturbed and who are seeking help, who, if you provide that, try to provide advice for them in terms of, say, for instance, a referral to a department or an agency that might better address their needs, they become irate and angry, and in a number of cases, in several cases, people will curse you out. And so we've seen this in a way that's been heightened, I would say, over the last 2 to 3 months. And on further conversation about this in department heads meeting, I mean, a number of other people sort of resonated with that. They too, in their own respective agencies, have seen the same thing. So it's something to be aware of. And certainly, in my view, the pandemic certainly is something that has exacerbated the stress under which people are living, and has, in fact, amplified some of the, mental and emotional sort of issues that people present, and just amplified them all the more. So this is mention that as just something to take note of, and that, and as we, move forward and provide services to our community. So that's, in a nutshell, that's my report.
Thank you. Are there any questions for Ken? Ken, I heard some very good feedback about the critical race theory program that you did, and I'm intending to watch it when I have some time.
Okay, great. Thank you. Thanks for sharing.
I'm sorry, go ahead.
Oh, I was just saying, just thanks for the comment, and hope you will enjoy what you see, and that it'll be beneficial.
Thanks. And I also wanted to say, what you're describing about an increased level of, I don't know the right word for it, out there, it certainly resonates with what I'm hearing and seeing myself. So I don't know, nothing more to say about it.
Yeah.
Except concern, I guess. Okay, next up is Kit Kephart, Department of Social Services.
Hi, everybody. So this is Child Abuse Prevention Month, and we at the Department of Social Services have been honoring our child protective workers this month. There are two days in the month, on the 1st and the 12th, when nationally people are encouraged to wear Blue Day. It's a day that by wearing blue, you show solidarity with people that are working to protect children from child abuse. So we have honored that at DSS this month, and honored our workers, as the state is also doing. So that's kind of a notable this month. And last Friday marked the official end to the contracted period for Code Blue services, which, as people know, Code Blue is the time of the year when when the governor has put an order in place that when the temperature is 32 degrees below 32 degrees or lower with wind chill, we house people without a full application for other benefits. So we have been doing that since last October. And even though that official contracted or kind of guaranteed part of the season ended on Friday, as you know, with snow expected tonight, we are continuing to actually have code blue in effect, because during those shoulder seasons, whether it's in the fall and it's gotten cold before we get into that guaranteed period, or now when we can get into the cold again, even though we're out of that guaranteed period, code blue goes back into effect. So we continue to house people, but we are working, we and St. John's are working very diligently right now to try to get people who have been utilizing code blue funding for housing to apply for temporary housing assistance or other supports to be able to get, make sure that nobody ends up unsheltered when the weather gets warmer. And the last thing I'll mention is just that I think I've said before that we are seeing a close to many of the pandemic related benefits, the additional benefits that people have gotten through temporary assistance or HEAP throughout the pandemic. Many of those are coming to a close in May. So there's certainly lots of other ways to support people. And we're anticipating soon a new housing program that I'll be talking about at this committee when we hear more from OTDA about that. So there's a number of different resources that are out there that we can support people with, but it's a matter of those pandemic related benefits coming to a close and people needing to reach back out to us so that we can assist them. So I think that's all for me.
Great, thank you, Kit. Questions, Randy?
Hi, Kit, thank you. Has there been an uptick in neglect and abuse cases, much like Ken just mentioned? Are you seeing or hearing more lately? And also, how do you track that? And is it gotten better over the years, worse over the years? I mean, I think it's a big issue, and I realize we only have a few minutes right now to talk about it, but if you give me a 1 minute response, I appreciate it.
Sure, I'll do my best. So what I would say is that we've been pretty consistent over the years for our county in terms of the number of abuse and neglect cases. And typically what we talk about, Randy, is not so much cases, but how many hotline calls come into our county. As you probably know, in New York State, all of the calls of abuse or neglect go through the state central registry, which then looks up where the call is coming from, and then they refer it to the local district, whatever the county it is. So that's kind of how we track that. Typically, we see between 1,000 and 1,200 hotline reports a year that we go and investigate or work with those cases in some way. We have not seen, it's been pretty consistent. There was a bit of a drop in the beginning of the pandemic because everything was closed. Schools weren't making reports because they weren't seeing kids, that kind of stuff. But otherwise, I would say probably for the last 3 to 5 years, we've seen very consistent numbers, no big changes, no big drop, no big increase. Where we did see a change and it really has not dropped back off is when we saw the opioid epidemic really hit. That really bumped up our numbers some and continues. I would say that since that point, we've seen a real intensity and more severity of cases. So that's kind of very generally where it's at.
Okay, one more question. So if somebody doesn't call the hotline, they just happen to call social services or somebody else, are they referred to the hotline? Is that what they're?
Yes. Anytime somebody, periodically people, they do what they think is right, which makes sense. They call us at social services and say, hey, I have a concern. There's a concern about, kids across the street from me or in an apartment next to me. I'm concerned about them. We refer them always to the hotline. The report gets made there. In fact, our staff are mandated reporters. So if we experience something in the parking lot or, you know, in the lobby, we also call the State Central Registry, make the report, and they take a look at the facts in the situation, make a determination about whether or not it's an accepted report, and then refer it to our staff. Even though it may come from our building, the whole process has to go through that State Central Registry every time.
Thank you very much. I hope.
Sure.
Veronica.
Thank you both. Kit, I think you said you were trying to help folks who've been using Code Blue to apply for housing assistance and such. What obstacles are you facing in that endeavor?
Well, the biggest obstacle, honestly, is just that we have a small population of people that we always worry about that really do not want to reach out, don't want to apply for benefits at DSS. And so we always worry about them, because what they tell us is that they are going to, they're going to go to the encampment, or they're going to sleep on somebody's couch, or they're going to do something like that. We want to provide the services that we feel like would be helpful. We want to keep people safe. We don't want people out in the elements. So the greatest challenge we have is that small group of people that, no matter our efforts, really choose not to come in and reach out to us. I would say that, you know, that's definitely the greatest challenge. The other challenge is just that it's a lot of people to manage and try to get them, you know, in and get all the forms filled out and get everybody processed so that we can get them on another funding source. So that's a bit of a challenge, but it's navigable. It's more the other group of people that really don't want to come in. That's harder.
Okay, thank you. And for that small group of people, is that like, do they not want to come in because like they've had bad experiences with ESS, or they don't want to be in the system? Or like, I'm sure you're thinking of individuals who can't share their personal stuff, but like whatever you can paint a picture of.
Sure. It's, you know, without saying too much, I would say that it really depends so much on the person, but I would say it's everything from, you know, mental health kinds of concerns where people really don't have trust. I mean, people have their feelings about DSS, but I think that most people in our community are aware that we really do try to work with people. And I think many people, even the people that are accessing Code Blue, are working with our staff, and they have to come in and meet with us. So I think it's pretty small, if not non-existent, that people feel like they can't access support through us. I think it's more concerns that are either related to, you know, people are concerned about what it means about them, what they're, you know, what kinds of concerns they might have about how they feel about themselves accessing services. And then there are some concerns that people have about sharing, you know, Social Security number or other, you know, information, because even though we are not a prosecuting authority in any way, the reality is that sometimes people have warrants out for arrests, or they have child support that's due, or they have things that they might be identified by accessing services. So it's a number of different factors.
Okay, thank you. That's a little different than I would have guessed, so that's helpful.
Sure.
And if I could ask one more question, do you feel like y'all have what you need to deal with what sounds like an expected impending increase in people looking for different kinds of assistance with the pandemic stuff ending?
We do. I mean, I think the question, you know, so we have a number of different, you know, program streams, and we have a number of different housing programs that have come online through the pandemic. When we talk about things like some of the PEBT, the pandemic benefits that have occurred, that have come about because of the pandemic, the bonuses in, say, SNAP, or the bonuses that people have gotten for temporary assistance or HEAP throughout the pandemic. I think that we certainly feel like we will continue to support people with all the programs that we can help people be eligible for. We will continue to provide all the supports around getting applications done before anything expires, that kind of stuff. The bigger concern that I have is we don't have a great read right now on how the economy is, how people are functioning out there. You know, I'm not sure when a family hasn't gone back to work fully, maybe, you know, maybe dad's working, but mom's not, or mom's working, but dad's not. And then the additional supports go away. I think what we don't know until they really go away is, you know, what other, how are families left? Are they doing okay? Or are they going to be left in a lurch by losing those additional benefits? And we just won't know that until we see it, you know, until we see those things go away and see what families do to close that gap. So as much as I know about that, I will share that, but it is difficult to get a read on it because we also don't always know, right, that people sometimes reach out and sometimes they close that gap, you know, by getting another job or doing something else that we don't know about. So I am hopeful that we'll be able to continue to support people with the programs that we have.
Awesome, thank you.
Yeah, I was just going to say that I've been here long enough to see a couple of times when we expected a big increase in demand for DSS services and it didn't materialize. And I've also been here when we've seen the opposite. Our caseload started rising and we never quite figured out why. So you never quite know. Randy.
Thank you. Obviously, homelessness has been more visible lately in more ways than one. And I know the city does have concerns there. Is there a task force working on this in any way, or is it, is there a plan to do something, or?
Sorry, I'm sorry, Randy. A task force to work on. I might have missed part of what you said.
On homelessness, I mean, I know there was a discussion about a group, the city and the county working together on that issue, and I didn't know if anything had happened from that.
Yes, so there are a number of different groups. We work very closely with the Continuum of Care. We're a member of the Continuum of Care, which is housed out of the Human Service Coalition, and there's a very integrated process that is kind of coordinated across for our community, for our county, that really helps to prioritize people whenever somebody is identified as homeless, and really helps to facilitate the process of getting people permanent housing as much as we can provide that. So there's a whole process there. We're just one part of it, but we contribute to all of that conversation and the process of looking at how do we serve people the best. So, yeah.
Randy, I'll have a little more to add about that at the end when I talk about next meeting. There may be something about that. Anything else for Kit? Kit, thank you very much.
Thank you.
Okay, next up is Department of County Youth Services, and I think we have Bridget Nugent here today.
Hi, good afternoon. How is everyone?
Good. How are you doing, Bridget?
Good, thank you. Just have a few updates on behalf of our department. So regarding the Runaway and Homeless Youth Program, the Family and Children's Services Open Doors Interim Host Home Program that our department had recently funded, they are in the process of recruiting to fill positions, and they are submitting the required paperwork for New York State Office of Children and Family Services. So we are hopeful that that program will be able to start in May. They've had some challenges filling those positions, much like many other providers, but they're working on that. Our department's request for proposals for 2023 youth development funding is currently open for applications on the Tompkins County BidNet finance website. The due date for that is May 13th. As many of you know, we're very excited to announce that TCAT has announced their free ride program for youth under the age of 17 that will roll out May 29th. And they're currently working with school districts and other partners to distribute the passes. They have some information available on their website, and that will be updated as we get some more information. And then lastly, the 2022 summer camp guide that our department develops every year is currently on newsstands via the Ithaca Times, and a searchable version is online via our department website. So that's what we have for you today.
Thank you. Any questions for County Youth Services? Okay, Bridget, thank you.
Sure, thank you.
Okay, we have Cindy Wilcox here, Human Services Coalition. Hello, Cindy.
Hi, good afternoon, everyone. Just a couple, it's day 6 for me on the job. So, I know everything I need to know, I guess. So a couple of updates from us. The county and city funding process is, we're gearing up for that. We are sending applications probably in the next week or so to past recipients, and then any referrals that we have received from any of the legislators over the past year. So that's moving forward. We are also kicking off this next week the Emergency Food and Shelter Program, which is federal funding for emergency food and shelter. Shauna Black actually is on the local board here. So that's starting up. We have a significantly more money this year in grant money due to some of the ARPA funding through the EFSP program. So we have about $120,000 in grant money to give away. So it's a nice chunk of change for our providers. And I guess to follow up with the conversation that you just had with Kit, we do have published our homeless and housing needs assessment for Tompkins County. We did provide a brief summary presentation to our homeless and housing services group. And I believe we're hopefully going to be on the agenda for this meeting, maybe next month.
Okay, why don't we be in contact later?
Yes, absolutely. Great. And that's all I have.
Thank you. Any questions for the Human Services Coalition? Veronica.
It sounds like we'll hear about it soon, but can we find that assessment results anywhere?
That is a good question. I will check with Liddy Barger, our COC coordinator. I think that we didn't want to publish it widely until we got the opportunity to present it formally to this group. So you will receive it hopefully momentarily once Dan and I coordinate. But I think that we want to keep it to this committee first so that you get a chance to review it and discuss it first.
All right, I can be patient. Thank you.
We'll be soon. Thank you. But I'll check with Liddy either way and see if if we can make that happen as soon as possible.
Do you have anything else for Human Services Coalition? All right, thank you, Cindy.
Yeah.
Did I miss anybody from departments? I think that's everybody. All right. A couple other little things to wrap up here. We have appointments, advisory board appointments. Got Tracy. Wait, hang on. To Mental Health Subcommittee. Got Tom Lipa to the Community Mental Health Services Board, and Kate Kelly McKenzie to the Tompkins County Youth Services Board. And Marley Brooks to Substance Abuse Sub. Somebody want to move those? Randy moves, Veronica seconds. Any discussion? Randy.
I just want to say, in looking over the qualifications of the people, a lot of very qualified people filling these roles. So we're looking at them.
Veronica.
Can I say something appreciative about one of the people?
I think so. Yeah.
Don't make it too sugary.
Okay, I'll just, more like closing some loops. Marley Brooks was one of a couple people who spoke at the, like, Community Mental Health Services Board meeting a couple months ago, last month, about some personal experience with losing someone to fentanyl poisoning, and more broadly about the effects that's having on our community. And that's really powerful. I think our public speaker today touched on, like, alluded to that. So it's just, I'm really excited to have her on that committee, and think that, like we heard earlier, listening to those people with personal experience of, like, loss and difficulty, and thinking about, like, who's not available to share with things is really helpful.
Thank you. Okay, we have the advisory board appointments moved and seconded. Any further discussion? Let's have a vote then. All in favor? Unanimous. Thank you. Minutes approval from the March 21st meeting. So we want to move that. Veronica moves. Can I have a second? Randy seconds. Thank you. Discussion? Okay, let's have a vote. All in favor? That is unanimous. Very good. Do we have any comments from committee members or liaison assignment reports, or anything anybody wants to say? Sam.
I just wanted to say briefly, thanks to Dan, our chair, and to the members of the committee here, and to the other folks too on Zoom for giving my constituent time to be able to tell her story today. Thank you very much. She was texting me, and she was very, very nervous about it, and she was wondering if people really heard her. And I told her she spoke very well, and that it was heard. So thank you very much.
Veronica.
The I'm about to say this wrong. The Human Rights Commission and the Community Mental Health Services Board are both looking for new members. So please encourage folks to apply, especially people who might, or you help them apply if the application is annoying for them. And that's all.
We had a number of budget adjustments and such for information only, and questions about those. Okay. And the last thing I want to mention is next meeting is Monday, May 16th, 3 o'clock. We have scheduled a presentation about childcare in Tompkins County from Melissa Perry from the Child Development Council. I'm just going to do a little bit of sort of an overview of the situation here, but then also some discussion about some capital projects, some building projects that are kind of on hold that well, you'll hear more about next, but they're significant and we should know something about these. And then, we have as one of our goals to coordinate with the city about as they develop their policy on camping and encampments in the city. And there's a group, apparently it's like a private group, not a city sponsored group, working on a proposal, and they're going to present it to the city committee Wednesday night, the Planning and Economic Development Committee, Wednesday night, about proposal for what to do basically in the jungle. And if the city endorses that, gives it the green light, then they want to come to this committee next month to share that information with us about what it is that they're working towards, because we will be a partner in it, or they want us to be a partner in it. We are a partner in it, we provide a lot of the services. So stay tuned on that. If they go to the committee meeting, the city committee meeting Wednesday night, and the city says no or not yet, then probably we won't have that discussion here yet. Any other business for today? All right, this meeting's adjourned. Thank you, everybody.
Amazing these apples kept.